Hello, everybody. Welcome to the event today, and we're live, Keith.
I'm so excited for today. Chris, I can't tell you how often I look at this top 20 group of companies and think it's our best ever. So I'm so excited for tonight.
Yeah, it's been a pleasure working with the top 20 so far and with the investor group as well, and really excited. I had a little sneak preview of a lot of the pitches tonight, and definitely can say that we're in for a treat for sure.
Yeah, I couldn't agree more. I think there's just such a glorious opportunity to get things going. And, I think it's also a really great indication of the strength of the health innovation scene in Canada, given how geographically dispersed not only the entrepreneurs are, but also the investors.
Absolutely. We have great representation from across Canada, like you said today, Keith, coming all the way from Victoria, all the way over to the East Coast as well. Really excited to be hearing these pitches. And for those of you that don't know, so I'm Kristen. I'm the investment program manager here at Spring. So I've been working very closely with these companies and investors throughout the process of this program so far. Most of the Spring team, including Keith, based over in Vancouver, but I myself am further on the East Coast here in Toronto. And Keith, for those that don't know you, although probably most of the people in the audience do.
Yeah, for sure. I'd love to say hi and introduce myself. So, hey, everybody, I'm Keith, and I'm the co-founder and CEO of Spring. And I just love how Spring exists to change the world through innovation and through programs like this with incredible partners like TELUS Pollinator Fund for Good. We are really at an opportunity point where we can really transform how health innovation happens and is fueled in Canada. So great to meet you all. I'm headquartered in Vancouver, and then we do work around the world. So really excited to connect with you here today.
Fantastic. That being said, we can get the slides going and just walk through what to expect for the event today.
Yeah, it's fantastic. I will pull them up for you. Great. And I'll move into slideshow mode.
Fantastic. Thank you, Keith. And so as you all know, we're here today for the Health Impact Investor Challenge, our top 20 pitch night, where we'll be hearing from 20 companies, incredible healthcare companies from across Canada that will be pitching. If you go to the next slide, Keith, what you can expect from today, we'll just do a few introductions and welcome to the event. You'll hear a little bit more from our Spring team as well as partners at the TELUS Pollinator Fund. After that, we have an incredible keynote speaker coming in. So Patricia Gagnon from TELUS and Bruno Lamb, they'll be doing a fireside chat. Then we'll be having our 20 pitches coming up after that with a short little intermission. At the end of the event tonight, you'll find out live which 10 companies advance on in the program. After that, there'll be a chance for some kind of open optional networking at the end too.
Yeah, and one thing I want to highlight to everybody is we have split the top 20 pitches into two groups of 10. That's going to give you, the audience, an opportunity to do a People's Choice Award for both groups of 10 and for the overall People's Choice Award. So just stay tuned for that. It is an opportunity for you to have a voice in on who some of these incredible companies are. And we'll be doing that during the intermission and then just before the top 10 are announced.
Absolutely. And Keith, if you could just spend the next couple of slides telling us a little bit more about Spring.
Yeah, and I'd love to start off by just respectfully acknowledging that we are, at least our headquarters in Vancouver, is located on the traditional, ancestral, and unceded territories of the Squamish, Tsleil-Waututh, and Musqueam nations, collectively the Coast Salish peoples. And Spring exists to change the world through innovation, and proudly member of 1% for the Planet and also a certified B Corporation. And we've had an opportunity to do this work on a global basis. While we were headquartered in Vancouver, we have now worked in more than 55 communities around the world. And that really does, I think, span, kind of all of the geographic cross-section of what's happening in impact. And it's something that we continue to see growing as a global movement and something that we're excited to see happening here in Canada as well. So just to give everybody a bit of context, we have been very busy and we've trained over 1,500 alum, worked with more than 500 companies. And through the work that we've done in the Impact Investor Challenge and also in some of our other investment readiness work, we've catalyzed more than $30 million in capital. And so at this point in time, I'd love to just hand it back to you, Kristen, so that you can talk about our partner.
Absolutely. We're so excited to be working with the TELUS Pollinator Fund for Good on this program. We are really aligned on the mission of advancing healthcare in the country, especially with an impact lens. Love to invite Bruno up onto the stage to quickly introduce the TELUS Pollinator Fund, and we'll hear more from him as well later.
Great.
Take it away, Bruno.
Thanks, Kristen. Thanks, Keith. I just want to also acknowledge that I'm coming from the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations as well. And it's been a great journey working with the Spring team, and wanted to really give a quick overview of what we're up to over here at TELUS Pollinator. So the fund itself is $100 million. It's one of Canada's largest corporate impact funds, and we want to focus our investment on for-profit companies and founders committed to driving social innovation. A question you might have is, what's TELUS doing in impact investing? I thought you were just a telco, which is a good question. It's born out of TELUS's leadership position in social capitalism and the belief, the really deep-seated belief that in order to do well as a company, we must also do well and do good in the communities that we live, work, and serve in. And so maybe a bit more on the Pollinator Fund. On the next slide, we want to showcase a little bit about our objectives. So we're looking to move the needle on social innovation in Canada by investing in companies and entrepreneurs, responsible businesses that are really driving solutions and moving the needle on 4 impact pillars. So those 4 are health, agriculture, environments, and enabling inclusive communities. We're looking to make investments in seed to Series A stage companies, and these companies are ideally are for-profit, purpose-driven, and do fit within those 4 focus areas. Of course, it goes beyond just the investments, and we want to work with our portfolio companies post-investment to enhance their positive impact, and whether that's connecting them to TELUS in-house experts, our network, or exploring collaboration with their business units. We look for different ways to support our portfolio companies. And finally, recognizing this is a fast-growing sector, we want to advance the impact investing ecosystem by mobilizing more capital from other investors, including funds, corporations, and those of you who are investors in the audience. And maybe finally, just showcasing a little bit about what we've been up to for the past year and a half now. Here's a snapshot of our 14 investments in our portfolio, and maybe I'd love to showcase 2 of them. First, Managing Life. They tackle the problem of chronic pain, which affects 1 in 5 North Americans. They have a clinically validated platform that helps chronic pain patients understand what is and what isn't working in managing their pain. And they work with health plans, employers, disability carriers to generate both positive health outcomes and also cost savings. So it's a win-win in both sides. As well, God Care is another example. They tackle the 2-sided problem of within the home care industry, with increased demand for home care that's not being met by the current supply of personal support workers, in addition to them suffering from burnout and poor working conditions such as low pay. God Care is a platform that efficiently matches these workers with patients in need. And both Managing Life CEO Tyre was speaking at a previous event back in, I believe, January or February. God Care CEO Chenny was part of the Spring Challenge as well last year. So really great to see that interconnection there. So just to wrap up, always on the lookout for ideas to transform healthcare outcomes, and being able to work with Spring has been so exciting and a phenomenal opportunity for us to get to meet founders and learn what they're working on. So to the investors, the founders, everyone in the audience tonight, thank you for coming out to the pitch nights, and we're looking forward to connecting.
Thanks so much for that. And, Bruno, just love the fact that you also highlighted that Chenny and the God Care team were part of our National Impact Investor Challenge last spring, and amazing to see the progress that they've made. Would love to acknowledge and thank all of our partners, including DLA Piper Inc., Tandem, MNP Active Impact Investing, and Carl Young Financial Services. So thanks to all of you. We'll be also announcing one of our latest and newest partners at the end. So really excited to do that. Kristen, would love to throw it back to you so that you can take people through the process and who the top 20 companies are.
Thank you, Keith, and thank you, Bruno. So really excited to show off a little bit of the companies that we'll be pitching today. We had over 100 different companies apply for this program, which is a chance to get around $100,000 in investment through this program and through these pitch nights. We and the TELUS Pollinator team ended up accepting 20 companies into this group. We're really proud to share that the founders of these top 20 companies, 50% of them are BIPOC and 40% of them are woman-led. As we talked about earlier, we have great national representation in this cohorts. We also are looking at a range of different types of healthcare companies throughout these pitches. You'll notice that there are a number of digital health companies, health technology. We have one health financing company, quite a few medical device and diagnostics companies, and a few others that are a little bit more niche as well. So get ready for kind of that ride of these different types of healthcare companies to watch. Each of these companies are in the pre-seed seed stage, raising anywhere from $250,000 to $5 million. And you can see here from these logos, just a sample of the companies that we'll be seeing pitch today. Fantastic. And so you might be wondering, who's judging these pitches? How are we deciding how we go from 20 to 10? And alongside the companies in this program is a group of investors. And so this is a combination of experienced angel investors and more novice people, everyday people looking to get involved in venture investing. Our cohort of investors for this health program specifically is our largest group ever at 35 investors that are participating in this challenge. And we're really, really excited to be sharing that they've collectively committed $165,000 in investment capital to be awarded to one of these winning companies at the end of the program. These people are anywhere from doctors, healthcare professionals, but also nonprofit leaders, communications professionals, financial analysts. So they come from a variety of different backgrounds. And during our intermission later today, Keith will share a little bit more about what they're thinking about when they're looking at these pitches and what the criteria they're using to judge these pitches. And that'll help you as an audience decide who you're picking for your People's Choice Award as well.
Amazing. I'm so excited for the experience that the investors are having, Kristen. And I think people are going to get a bit of a taste of that today. When we go into the intermission, everybody, Lucy, who's on our team, and I, we will also be talking through some of the decision-making framework that the investors are using. But in the meantime, I am so excited for our keynote speaker. Kristen, would you love to make the intro?
Absolutely. So tonight we have a fireside chat. So Bruno Lamb, who we just heard speak as a senior investment associate at the TELUS Pollinator Fund, Bruno will be joined by Patricia Gagnon, who's the head of innovation of collaborative health at TELUS. Really excited to welcome the two up to stage and learn more about the work that they're doing. Take it away.
Great. Thanks again, Kristen. I'm thrilled to be here with Patricia and really get to dive into the next 20 minutes or so, learning a bit more about her experience in health and digital health and what TELUS is doing. So maybe we could just start off by having Patricia tell us a bit more about what TELUS is doing in health and what is your role within TELUS Health.
Thank you, Bruno, for the introduction. And I have to say, I'm really excited to be participating to this event today. And indeed, I mean, many people they really know TELUS that, as a telco, but in health, like, what are we doing in health? What is TELUS Health? So I think it's a great segue to start the evening. And, what's our mission? Well, it is to improve healthcare experiences through everyone, for everyone in Canada so that they can proactively manage their health and well-being via various products and services. I could provide you with an org structure with our divisions, but I kind of like numbers. So in this case, I think that they actually speak for themselves. In TELUS Health, we provide, so more than 13.3 million of Canadians are covered by our TELUS Health benefits management solutions. More than 127,000 healthcare providers are using our health technologies. We have 130 million electronic claims that are processed through our systems every year for health benefits. More than 2.2 million Canadians have access to our virtual care services. We have 15 care centers across the country providing executive health and 2 MyCare clinics, which are kind of, open to public free clinic services. TELUS Health has committed more than $150 million to support COVID response efforts. We have 14 TELUS mobile health clinics. These are little trucks providing cares in remote communities. Our home health monitoring platform is used by Canadians in 4 provinces, and 30,000 clinicians across the country use one of our electronic medical record systems, so our EMR or EHR. And finally, over 1 million Canadians who use our personal health records. So these are pretty powerful numbers for a company that like most of the people don't even know that we're in health. So now what do I do? So I lead innovation for our collaborative health division. So the one division that has our EMRs and chronic disease management platform. But my primary focus right now is leading a super project that we call the Sky Health Innovation Lab. So this project is meant to answer the following question. How do we help people live better and longer by providing clarity on what healthy really means to them personally and help them sustain it for life? We really want to enable prevention and early interception of disease using imaging tools combined with biomarkers and genetics/genomics profiling to capture, analyze, and process massive amounts of data to create digital synthetic twin, to then improve self-awareness, empowering people to track and act on their real-time data, such as physical, social, and psychological markers. So by giving individuals that in-depth knowledge, we're then able to use behavioral science and coaching to generate new neural connections and change mindset so that whatever goals they'll be setting for themselves, they'll achieve. So our first flagship location will be in Calgary in our Telesky building and is set to open early 2023.
Very cool. And for those in Calgary, I was there last summer and such a beautiful building. Can't wait to see it in action. So Patricia, thanks for that overview. And we're going to maybe dive back into Sky a little bit more later on in this conversation, but maybe just to back out a little bit, thinking about the industry itself. So TELUS obviously is a technology company, and so are many of our healthcare startups in this cohort and the broader Canadians ecosystem. And we've seen digital innovation across the spectrum within health, whether it's easier access to doctors through telemedicine or other digital front door technologies to streamline and better coordinate communications. So question to you is, what are you most excited about for the future of digital health?
Well, interestingly enough, 5 years ago, I would have said virtual care. And look where we are now. So, and I'm going to take a minute to address this opportunity because it's still relevant, even if that's not going to be my real answer to the question. But right now, there's a trending shift to location agnostic care, or what we call care anywhere. But the way I see it, virtual is just a modality. Care is care, whether it's done in person or virtually. Now that it's well accepted, I mean, the challenge revolves around the traffic management piece. So as Zoom or other video conferencing technologies allow for consultations to happen, it dismisses the typical patient journey, which involves the medical secretary, the medical file to be updated, the pre-consultation with the nurse, let's say if you're pregnant or if you have heart problems, and the post-consultation activities that would normally happen in a physical location, like an in-person consult. So with the sense of urgency brought on by COVID, everybody wanted to do, telemedicine, but we kind of forgot that all these activities need to be part of the patient journey. And right now, for those who are listening, just a heads up, very few platforms offer the ability to manage traffic through, let's say, care pathways. So, and now I think this is really important for entrepreneurs and for, the general, let's say, population to understand that there is still that gap. Telemedicine was not really popular 5 years ago, and now, it's booming, but there are still some gaps. But to circle back to your question, what excites me the most, I mean, right now is definitely data, artificial intelligence, and machine learning.
Yeah, no, I love that. And maybe I'd love to have you expand a little bit more on that. Like how can we use AI and machine learning data to start solving those inefficiencies and challenges that we see in the current healthcare system?
It's a broad question. Being an ops person, for sure, solving inefficiencies is kind of the obvious and low-hanging fruit for AI and machine learning. But so kind of like, how do you use algorithms to accelerate patient triage or to predict chances of a patient sticking to their treatment or not? Or chronic disease management backends that allow for monitoring of a higher patient to nurse ratio. These are all, great, and they allow for cost saving. And they also address universal issues such as, staff shortage that, we've all seen and we all hear right now, especially after COVID. But if you ask me what my real excitement, comes where it comes from, it's really from the potential to improve health outcomes and, ultimately saving lives. I think, being a bunch of entrepreneurs here and investors, this probably feeds the why we do what we do and why we get up in the morning. It's to make a difference. And it ranges from, building clinical decision support tools to confirm appropriate medication to, let's say, AI even performing complex stroke diagnostics. So from passive data collection, including data from, those beautiful wearable devices now that are booming, to finding creative ways to help patients not feel the burden of the process of getting the care they need, along with incorporating, social determinants of health to better target interventions. Possibilities are endless. And you know what, Bruno? We're only beginning to scratch the surface.
That's really exciting. And it sounds like we're just on the verge of another era or trend in healthcare. So as I mentioned before, I'd love to bring this back to you and what you're doing at TELUS. And so can you share a bit more about what you just mentioned in terms of the trends, what you're most excited about links to Sky?
Sky is definitely the application of what I just, mentioned. So when we look at data, we look at, noise versus signals. So if you take imaging data, for example, MRI images, they're often used in silo, and they're used to tell a specific story about, let's say, something that happened to a body part or, through an accident. However, if you were to combine that same imaging data to labs, so bioanalytics, biomarkers, and, add, let's say, a layer of genetic predispositions to this, you would probably get a very different story. So at Sky, this is what our focus is going to be, is to be able to find these correlations that help screen background noise to surface signals and pressure test some of our assumptions that we have right now.
Very exciting. And that's a big mandate and very exciting for the future of healthcare in Canada. I know that TELUS is a big believer in collaboration and partnership. And so we're going to shift a little bit into kind of what your advice is for startups. But maybe just before that, curious to see with this vision, how might you envision TELUS working with others and how do you source innovation for Sky?
There's a difference between UNES innovation and evolution. We definitely want to focus on innovation. So we have a very specific outlook. We do want to partner, with innovative companies and find, the latest and the greatest in, what's being developed. I come from a digital healthcare startup, so, I can tell you that it does happen. We were acquired by TELUS. We were a telemedicine company 4 years ago now. Time flies. Partnering with TELUS has its advantage, and you never know what can actually happen. So we're looking forward to working with different startups and different companies and to provide them kind of the springboard that they need, whether by using our data or sharing data or by piloting new technologies in our facility.
Yeah. We definitely at Pollinator 2, we carry that mentality of, where can we find collaboration points, areas for partnership between who we invest in and as well as our business units and the exciting work that they're doing. So really great to kind of hear from your end, having experienced on the other side as a startup, on the startup side, and how you integrated with TELUS, and now that you're with TELUS, how we might work with other companies. So yeah, we alluded to this. Patricia, you have a pretty interesting career path coming from a startup prior to joining TELUS. So for the existing and future entrepreneurs in the audience today, what would be your advice for startups in the health space?
There are a few. Let's put it this way. This is what my experience taught me, through the startup world. First of all, is be bold. Innovators want to see that you have a vision that goes beyond what's already available. They want to believe that you're not just reacting, to the current environment, but rather shaping the future of it. Be smart about what you see as a gap. If you're in business, it's obviously because you believe that there is a gap in the market and therefore there's an opportunity. But don't just look around you. Do a complete international market scan. Maybe someone has thought about this idea. Maybe, a large organization can or can't do what you're actually, building, and they can do it maybe faster than you are. So see where you can fit in and where they can leverage you or what you're building. The third advice would be integrable. Design to have an API, design to be system agnostic as much as you can, and think ahead. In Canada, certain requirements are not necessary, but what if you have an opportunity in the States? Like, you need to be fire compliant. You need, some of the standards are we might not consider them right now, but think ahead. If you can develop your own platform if you cannot develop your own platform, or if you have to rely on open source or third-party solutions to build, choose the big ones, even if they're more expensive. To be honest, that way, the risk of them going out of business and you being without a solution is a lot smaller. Privacy and data security is a must. SOC 2 compliant, SOC 2 certified, or the ISO. I have shivers every time I say the word ISO. It brings anxiety to my life, but still, it adds some weight. It adds credibility. It's costly, but there's a way to do it from the get-go. And if you plan it in advance and design and structure your product accordingly, you're going to save, and you're going to save both time and money. Also, current needs change all the time. We're developing AI and ML, and this is speeding things up. Finding patterns that make what used to be a guessing game, it becomes an ability to predict. So market is changing at a fast pace. Just be on the lookout for these changes, because maybe they, will help you, or maybe they're going to allow you to speed up, or maybe, they're going to slow you down. But at least you'll know. Last but not least, always have an exit strategy. That strategy will change a million times, and it's fine. But you need to know what you're attacking. So are you preparing to climb Everest, or just climbing Grouse Grind for the ones that are out west? Because I love that mountain, and I'm definitely from Montreal, so I wish I could do it often. But I mean, the exit strategy will change. But just knowing, what you want to get to, will give you at least the direction.
Well, I love that. Yeah, and it's almost Grouse Grind season, so definitely got to prepare for that. Yeah. Well, Patricia, thank you so much for your time and expertise today. It's been such a pleasure, personally being able to work with you and your team at Collaborative Health, and also just hear from your experience, both as a TELUS health representative, but also as a entrepreneur previously within a startup. So it's been really great learning from you on the trends within digital health, and I really look forward to, I know speaking for you too, look forward to seeing the pitches from the top 20 ventures today.
Looking forward to it too. Thank you for having me this morning. Well, today.
Amazing, Patricia. Thanks so much for your time. I was fantastic. I was trying to take as many notes as I possibly could in the chat and highlighting some of your key points. So absolutely fantastic. And we look forward to seeing any comments you might throw into chat as well as the pitches are happening. But thank you for being here.
Thank you.
Awesome. Well, Kristen, I think we are getting to that time, and I hope everybody's excited. How are you feeling?
I am feeling excited, as you said, and great. And as you said, just kind of digesting all that we just heard from Patricia and Bruno. In terms of next steps here, Keith, we're about to jump in and go into our pitches. And you can see there, Keith, the next slide will tease for the audience here the companies that are coming up and the order of the pitches that they'll be in. So really excited to start to kick off with our pitches. In terms of what's going to be happening next, our investor groups, the 35 individuals that are our judges, our voters, those committing capital, I'm going to be running away with them, Keith, and we're going to be starting the deliberations process to figure out which 10 companies will advance on. And you and our audience and all the entrepreneurs present have the pleasure of being able to watch these pitches while this goes on as well.
Yeah, absolutely. And so, Kristen, have an amazing time with the investors, everybody. This is going to be such an incredible real-time experience as they're watching the pitches. They're going to be scoring, they're going to be talking, they're going to be working through it. We as an audience will be able to do the same in chat and then also through the People's Choice Awards. So, Kristen, all the best. Good luck with the investor teams, and looking forward to hearing the results soon. And so, everybody, we are going to be diving into this top 20. You can see that what we have done is we've broken up into two groups of 10. That's going to give us an opportunity to see 10 amazing companies, take a short intermission, talk through a few things, give you some observations. And then from there, what we will do is see the second 10 and then move towards the next step. So what I'm going to do now is I'm going to just pause my screen. And I am joined on screen, everybody, by Lucy. Hey, Lucy, how you doing?
I'm great. Keith, how are you doing?
Good, good. It almost feels like I could make a joke about, those Holiday Inn Express ads where it's like, hey, I just saw you at the Holiday Inn Express, and so now you're an expert. But for everybody, Lucy's an incredible member of the Spring team. She is based in Toronto, along with Kristen. And one of the things that Lucy has really come to be known at Spring is really a couple of things. And one of them is that she is a really outstanding pitch coach and has been through a lot of pitching herself as an entrepreneur. Why don't you just give us a quick prelude? Like, what's it like as an entrepreneur to make a pitch?
Oh, thank you. I mean, what a compliment. Thank you, Keith. Yeah, I mean, the first pitch competition I did was very nerve-wracking. My palms are very sweaty, but it's exciting. It's a really amazing process getting to the point where your pitches, you've got a 2-minute pitch and it's really succinct and it really encompasses everything about your company, your mission, your team, and your traction. I mean, just going through that process myself, getting my business, Earth Pop, which is a dog treat company. We take food that would usually be thrown out, we upcycle it into dog treats. And I had a pitch competition last year. It was my first one. And getting my pitch to the point where we had 2 minutes ready to rock. That alone was a really incredible process that I hadn't been through before. So it's nerve-wracking, but it's really exciting.
Yeah, amazing. And so everybody, as we go through, Lucy and I are going to be making comments on the pitches as we go through. I'm really excited to share that with Lucy. And just one piece of logistics that I want to share with everybody, actually maybe a couple. First, when you go to the chat, you'll see the chat, and then beside the chat, you'll see polls. Please do respond to the polls. Let us know who you are. Let us know where you're coming from, and then you will get a chance to do People's Choice. Second piece of logistics, we have 20 pitches. What we have done is we've had every entrepreneur pre-record their pitches. And the reason that we've done that is we want to level the playing field from a technology perspective. So no one's at risk of a technology hiccup impacting their pitch in any way, which means that they all stand on equal ground. And I think it'll make for a great set of pitches. So with that in mind, Lucy, I think I will get you to kick things off and introduce the first company, if that works for you.
Let's do it. Looking forward to diving into all of these pitches with these fantastic companies. So first up, we have Connection Point. Connection Point Systems is a platform for collaborative funding that helps causes, corporations, and communities work together to fund impactful projects with an emphasis on healthcare.
My name is Daryl Hatton. I'm founder and CEO of Connection Point. Connection Point is the platform for collaborative funding. Our mission is to help corporations and community members collaborate to fund impactful projects. Our advanced digital fundraising technology powers CocoPay, our innovative new healthcare financing brand. People worldwide struggle with financial hardship from the high costs of medical care. It is particularly acute in America, where 137 million can't afford the medical bills. In response, many try crowdfunding. Over 250,000 GoFundMe campaigns raised $650 million in 1 year alone. The market opportunity is massive, as over $560 billion was spent on uninsured, out-of-pocket healthcare expenses last year. Many people are hesitant to contribute to their friends' crowdfunding campaigns because in the current model, there's no accountability for how the funds will be used. We created CocoPay to solve this problem. All funds raised through CocoPay are paid directly to the healthcare provider. Providers can now help more patients who would otherwise be underserved. We charge the provider a 5% commission on this new revenue stream. CocoPay is disrupting the crowdfunding and healthcare financing markets by unlocking a new and secure source of revenue for providers. We have strong, experienced leadership driving our team of 24 people. We've also assembled a very talented and experienced advisory and governance team. As a company, we're making a big splash with the impact we've generated so far. Our platform has helped over 200,000 crowdfunding campaigns raise almost $250 million. A significant portion of these campaigns have been to fund personal medical expenses. The campaign shown here helped Matthew raise over $70,000 for his cancer treatment with the help of almost 400 people in his community. We designed CocoPay to help millions of people afford the healthcare they need. We're currently raising a seed round of $1.5 million US and have already closed 1 million of this round. I'm Daryl. Let's do this.
I love that ending. Let's do this. Great market opportunity for this company. I mean, I've seen so many different GoFundMe pages for medical expenses, both for humans and pets. Huge market opportunity.
Yeah, and for everybody watching, like, first, great at market opportunity. Second, you heard the traction, including the traction on the fundraise. And then Daryl, who you just met, Daryl is an experienced crowdfunding entrepreneur. He helped to launch Fundraiser, which was really the first leading crowdfunding platform for nonprofits and charities, dating back a few years ago. And so he's a real expert in the space. And so it's a great way to see that team validation can jump in. So great intro pitch. So I'm going to jump over to Flutter Care. Everybody, Flutter Care is building life-saving technology to predict and prevent pregnancy complications through education and remote health monitoring. And they've got some pretty incredible patents pending technology that is really designed to protect both the parent and the child, the baby. And so really powerful, and I'm excited to see their pitch.
Mothers are integral to our lives, yet too often we take their health for granted. My mother almost lost her life giving birth to me. And as a birth worker, I know that the care pregnant people are receiving isn't good enough and that our communities are suffering because of it. Every 2 minutes, a woman around the world dies from pregnancy. In the US, one of the wealthiest nations in the world, mothers and babies are dying from preventable causes. At Flutter Care, we're building life-saving technology to predict and prevent pregnancy complications, starting with stillbirth. Our technology helps to protect both the baby and the parent. Our predictive analytics, personalized education, and culturally sensitive approach to care sets us apart. Through the insights of over 200 individuals, we know that the more at risk and underserved, the more likely they are to benefit from our technology. To date, we have more than 300 users across over 45 different countries. We have 1 patent pending and 9 health organizations recommending us to their communities. We'll generate revenue through in-app advertising and a premium app subscription. And with the focus on underserved populations, we'll reach 5 million users within 3 years because we've seen Ovia do this. This means a revenue of 21 million by 2025. Since launching last week, we're on track to reach our first 1,000 users by the end of May. We'll start generating revenue in July and launch institutional partnerships in September. And we're the team to make this happen. As the founder of this company, I bring my experience as a certified doula and engineering graduate. In 2020, I was the youngest recipient of the Engineers Canada Awards. And beside me is a dedicated team with expertise in product development. We're raising a pre-seed round of $600,000 to reach our first 100,000 app users by investing in staff, marketing, and R&D. When families thrive, communities thrive. Let's make pregnancy safer for all of us.
Amazing. Lucy, you know, one of the things I always see when I hear somebody talking about a global opportunity with underserved markets, users in 45 countries already. Just an incredible story that is backed by, I think, some really meaningful early market validation.
Absolutely. Huge opportunity for impact. And next up, we've got BioTwin. So BioTwin harnesses AI, biomarkers, and biometrics to create a virtual human copy. These digital twins allow early detection and prediction of diseases and innumerable simulations. Through a toolbox ecosystem, this technology is revolutionizing the wellness and healthcare fields by making personalized and preventative medicine a reality.
Hello, everyone. My name is Philippe Magnan, co-founder and finance director at BioTwin, a personalized preventive healthcare platform. The problem that BioTwin tackles is the major lack of prevention in our healthcare system. What BioTwin brings to the table is a solution to the silo approach, lack of AI, and very little personalization that are making healthcare in general reactive rather than proactive. So concretely, BioTwin's solution is to build a virtual replica of you, for which the technical term is health digital. If we take a look at what a health digital twin can do for a healthcare professional, detect diseases early, predict unforeseen events, and even simulate treatment plans. So in other words, digital health twins are the next gen of diagnostic aid tools. BioTwin's early business model is to partner with healthcare and wellness companies and professionals who will offer the digital twin solution to their existing clients as an extra to their already existing services. This makes Biotin's business model extremely scalable, as we will be focusing on developing impactful partnerships, thus increasing the number of paying end users along the way. Now a little more about the people behind the technology. We have a senior management with more than 60 years combined experience in the tech and biotech industries, a dedicated team of experts who are generating the data, analyzing the data, and managing Biotin's numerous pilot projects. And finally, a wonderful team of advisors who are all industry-leading experts in their respectable fields. So in less than 2 years, we went from 2 co-founders to more than 20 multicultural employees. We developed 6 pilot projects, including a major one with Novo Nordisk. We recorded our first sale, filed 3 patents, raised more than $3 million in grants, and $3.5 million in private investing. And our ask is to get $4.5 million to accelerate R&D. Together, let's improve and save lives. Thank you.
Wow, great team behind the company. And it's also fantastic to see representation from one of our French Canadian companies. And Keith, I don't know about you, but I would love to have a digital twin. That would be fantastic.
Actually, I'd love to have a physical twin that would do my vacuuming, but that's another story. But I totally agree with you. And for everybody, that company representing the national scope of health innovation coming from Quebec. This next company, Raya Health, coming from Ontario, is creating a personalized experience to guide people through their birth control journey. For me, this is an example of an incredible founder diving into one of the great challenges in femtech. And femtech is, I think, one of the fastest growing sectors of healthcare and health innovation. And I'm really excited to see their pitch. So let's see what we are going to hear from Dallas.
Hi, everyone. My name is Dallas. I'm the founder of Raya Health. Birth control is often misprescribed. The current contraceptive counseling process leads to a grueling trial and error where 75% of women have negative experiences. It's also time-consuming and expensive. Raya's digital platform makes navigating birth control easy and effective. Our smart algorithms utilize in-depth member profiles to match users with birth control solutions. Our birth control boundary tracking system supports users in managing any side effects or symptoms. Raya is the go-to resource for personalized reproductive health information and support. Nearly 1 billion women use birth control worldwide. Our initial target audience is young people struggling with this problem firsthand. We sell our service direct to consumer on a monthly membership. Our growth model is B2B recurring revenue streams such as university student health and benefit plans. We've served over 100 beta users, have a 25% community growth rate, and secured a B2B partnership. Our team consists of dedicated experts, including a University of Toronto professor and doctor at Planned Parenthood, as well as the former Growth Partnerships Director at Ancestry and Digital Marketing Director at Sephora. We do this work because the current contraceptive counseling process is failing women. 50% of pregnancies are unplanned, and women are hurting financially and physically. With informed consent and choice, women are more likely to use their contraceptives properly and lead healthier and happier lives. We're currently raising a pre-seed round of $500,000, and I'm happy to answer any questions about it or our mission. Thank you so much.
Lucy, sometimes you hear a pitch, and as soon as you hear it, you say, that's common sense. And often the sign of an incredible opportunity and a great company. And so for me, that was really compelling. Love to hear your thoughts, and then you can introduce our next company.
Great. Certainly very compelling. And honestly, it's an issue that's often overlooked in our healthcare system. I know many stories of that. Yeah, I've heard many stories from women that relate to this. And I feel like also for all the pitches we're seeing tonight, every single pitch I see, I'm like, that I want to use that. I want my family to make use of that technology as well.
Yeah, well said.
So next up, we've got Mindful Garden. Mindful Garden is designed to de-escalate anxiety and aggression associated with chronic disease in institutional care settings. Built on a video game engine and powered by the individual's own agitated voice and gestures, Mindful Garden comes alive on screen with engaging computer-generated imagery that progressively calms disruptive behaviors, eliminating or reducing reliance on drugs and restraints.
Catherine Winkler, and I'm Esther's daughter. After my mother died a high-profile death, in large part due to undiagnosed delirium, I knew that psychotropic drugs and restraints must not be the tools of first reach in caring for our elders. We pivoted our award-winning digital innovation company to digital health, building an evidence-based behavior modification platform to address anxious and aggressive behaviors in the hospitalized elderly, beginning with delirium, an almost completely untapped market opportunity with status quo use of chemical and physical restraints far and away the main competition. An acute mental change, delirium can happen all along the patient care pathway, from emergency to ICU, post-surgical ward to hospice. Delirium's impact can be quantified in high financial and human costs. And we all know of a senior who went into the hospital for heart or hip surgery only to pass away as Esther did, or return home and never be quite the same again. Our first product, now in paid evaluations with co-dev sites in Canada and the US, has been described as the digital crash cart for behaviors, brought in to distract, engage, and de-escalate. Built in Unity, it integrates biometric sensors that respond directly to patient inputs, facilitating the patients to self-calm without reliance on one-to-one bedside care. Adding to our studies in long-term care, we just completed a foundational study that saw significant de-escalation of patient agitation levels and a 25% reduction of PRN medications. We're a strong team of digital content and platform specialists, now joined by a hands-on medical advisory in both Canada and the US. We've received $300K of our current seed round to complete our milestones toward commercialization in 2023 of our first product. We hope you agree this unaddressed market is worthy of support. Thank you.
Such an interesting pitch. The impact on financial costs and also life-saving care is so clear here. And it's a really interesting use to see video games and screens combined with biometric scanning to be used to solve this problem.
Yeah, and an excellent example as well, by the way, of how you can take an incredibly experienced and deep team and apply them to a specific challenge to deliver real results. So I thought that was fabulous. Lucy, up next, we've got Voxel, and they're developing a human-like cancer tissue model for reliable preclinical testing. It's a bit of a mouthful. Their tissue models contain vasculature, mimicking the delivery of anti-cancer therapies like in the human body. And so they've developed an incredible set of technologies to accelerate the drug development process and reduce the number of animal models used for drug testing. So multiple layers of benefit here. Really excited to see Voxel's pitch.
Hi, I'm Dr. Carolina Valente, CEO of Voxel. Did you know that 95% of oncology drugs fail to get to the market? And this is associated to how these drugs are tested. Preclinical testing is performed in very simplistic platforms, and the results, they just fail when testing animals and in humans. But Voxel is creating our solution. Voxel is developing fully vascularized, human-like cancer tissue models. Our tissue models will be applied to the drug development process, and we'll be able to identify inviable candidates earlier in the drug development process, with the potential to reduce the number of animal models used during testing and also saving time. These tissues are created by combining our bioprinter, our proprietary bioinks, and our vascularization software. We'll be targeting academia, research centers, contract research organizations, and pharmaceutical companies, selling our tissue models and our bioinks with 70 and 90% margin, with the main focus on our tissue models. Our tissue models offer significant benefits over the conventional platforms, since we have full-on blood vessels. The drugs can then be injected through the blood vessels, mimicking what happens in the human body. We just opened our pre-seed round in December for $1 million, and we did our first closing in March for $550,000. We are currently seeking the remaining 450. The money will be mainly used for validation studies, comparing our tissue models to animal models. Every Voxel team member has been impacted by cancer in some way, and we show up to work every day motivated by our shared mission and our passion for science. Our mission is to accelerate life-saving therapies getting to the market sooner for the cancer patients, and I hope you can help us to make this possible. Thank you very much.
Yeah, just for me, like just an incredible example of how you can have subject matter expert team, in this case, an incredible medical team behind the company, and really kind of driving that confidence that the investors can have that they really understand the market and the problem, and some really interesting intellectual property too. This is big science.
Yeah, very interesting. I'll be honest, I've never heard of a technology that can actually reduce the number of animal models used in drug testing. Very fascinating. Yeah, so next up, we've got TalkTech Technologies. TalkTech Technologies is a digital health tech company whose mission is to build smart, cost-effective senior care solutions that offer caregivers peace of mind while enabling seniors to live healthier and safer lives.
5% of long-term care in Ontario report staff shortages, leading to basic needs not being met, especially during the overnight shift. Seniors with chronic diseases often have sleep issues that leads to the risk of fall, seizures, and wander away, etc. How can we help to effectively provide quality care with limited care resources? My name is Jessica Young. I'm the CEO and co-founder of TalkTech Technologies. We created an award-winning product, SleepSense, a palm-sized device that placed under one leg of the bed. It's a long-contact, non-wearable, automatically tracks sleep and detect risk situations and call for help. SleepSense provides continuous monitoring to augment the in-person checks. It helps to ensure the resources are utilized in the most efficient and effective manner and reduce staff burnout and stress. The sleep data and reports help to adjust care plans and adding interventions. This will result in reduction in falls and better quality sleep for seniors. Our revenue model is device fee plus monthly software fee. We sell through our global distribution partners. To date, we have made early sales of over 1,000 devices with software. We have supported over 2,000 seniors in 14 care homes across 7 countries. We're piloting SleepSense with the largest care home in Australia and China, which leads to potential sales to support the current 20,000 residents. Many countries are already experiencing challenges in supporting a growing senior population as they age. Our mission is to provide solutions as innovators to enable smarter care for better health outcomes. We have the right resource in the team and proven capabilities. We're raising funds of $1 million. We need your help, and we invite you to join us on our journey to success. Thank you.
What an interesting product. I love the product showcase from the founder during that pitch, and it's also great to see the traction they're having with already being in 14 senior care homes and many more partnerships on the way.
Yeah, especially because it really helps to validate that they understand the sales process and really like how to describe the problem and the solution to those who are their customers in this kind of B2B model that they're pursuing. So I would agree completely with you, Lucy. That's a great observation. Next up, everybody, Dara, Nano Biosense, medical nanosensor diagnostics lab based in Toronto and also in Boston. Their flagship product is a nanosensor on a thread to detect cancers from saliva or breath. Their vision is to make medical diagnostics affordable and accessible, thereby reducing mortalities and morbidities. Sounds like an incredible piece of technology or set of technologies, and I'm excited to learn more. Let's watch their pitch.
Hi, I'm Avi Ambale, and I founded Dara to solve a very personal problem. In 2016, I was diagnosed with oral cancer, and the reason I'm not a statistic is because I was diagnosed early. And that happened because I had access to quality healthcare and the means to pay out of pocket. Because out-of-pocket costs are 61% higher for cancer in North America. In 2014, after I lost my dad to cancer, I had the inevitable why me question. After I survived, that question became, how do I build a medical diagnostic device that is usable by anybody with limited to no medical training, is accessible anywhere and at any time, and is very, very cost effective? I could answer that question because my doctoral training was in biomedical engineering. And the fact that I have a few successful startups under my belt allowed me the ability to assemble a team that worked at the intersection of basic and clinical research. Collectively, we built a smart thread that can detect cancers from saliva. We've published our work in Nature, the highest ranked journal of scientific research. There's me talking to Ruslan Salakotid now, the head of AI research at Apple. We won a few NIH research grants that have lower than an 8% chance of success. We'd like to reduce the mortality and morbidity associated with cancers, and we aim to increase the coverage by 25% more than that recommended by the Canadian Task Force on Preventive Healthcare. And the reason we'll be able to do that is that our product will be a tenth of the cost of conventional screening mechanisms. We are truly unique among a field of 3 labs working on saliva omics globally, but what sets us apart is that we've scaled scientific ventures in the past, and that impact is baked into our DNA. To bring saliva omics and saliva diagnostics into the mainstream, we're looking to raise $500,000 in a pre-seed round as a safe instrument. I look forward to hearing from you. Thank you so much for your time.
Just that ability to combine the personal story with the experience and track record of a proven entrepreneur, powerful. Just incredible. Any thoughts from your side, Lucy?
It's an incredible story. Like, what a why behind an entrepreneur. I remember when I first saw this pitch a little while ago, it stayed with me, and I was texting my sister and I said, you got to check this out. Like I said, Keith, I feel like all of these pitches that we're seeing tonight and all these technologies, I want to be able to use them all.
I know, and I don't envy the investors. Like, they've got 20 incredible companies to pick from. So who's up next?
I think are we doing a little intermission right now? Or are we going straight through?
No, I think we got 2 more before we hit the 10 mark. Yeah, we're getting close though.
Okay, perfect. So next up, we've got Lyme Health. And Lyme Health works closely with healthcare organizations by offering an end-to-end patient relationship platform to improve the quality of care and healthcare services. Their HCAHPS and Accreditation Canada survey tools allow organizations to get instant feedback, measure impact of process changes, and quickly act on improvements.
Hi, I'm Francis Robichaud, founder and CEO of Lyme Health. We're super excited to present our company that works at improving the patient experience by offering healthcare organizations a tool to help them measure the patient experience in real time and take concrete action to actually improve healthcare. We all know that it can be really hard for patients to navigate the healthcare system. Most of the documentation and guidelines that are shared with them still rely on paper and manual processes. This leads to very poor patient engagements along their care journey. And when the organization asks the patient for feedback on their patient experience, well, there's no surprise that they get very little results, which is needed by the organization to comply with the regulations with Accreditation Canada here and HCAHPS in the US. Lyme is a unique B2B SaaS platform that's being used by healthcare organizations to streamline communications with patients. We do so by structuring and centralizing all the documents that need to send patients in pre-op and post-op, as well as centralizing patient experience measurement. The patient engagement space is poised to grow over the next decade. It's evaluated to reach over $25 billion in North America only by the end of the decade. We're currently fundraising because we want to capture the biggest chunk of this growing market as fast as possible. So we really want to invest in our resources and our team to grow our footprint in North America. We currently have very good customer traction in Canada, and we're just entering the US market. We're super excited to be partnering with you. Together, we're going to have a real impact on improving the relationship between citizen and their healthcare system. We're going to help healthcare organizations and medical services to benchmark themselves against similar organizations. We have a long-term vision to grow this company in a very impactful company. Join us and let's work together to improve the patient experience.
All right, very impactful pitch. The team did an excellent job of showing why they're fundraising and also what their use of funds would be.
Yeah, and I think part of what I liked is COVID has shown the critical necessity to have solutions in both urban and rural environments. And I just really love how they've been digging in and kind of thinking about that at the doctor office level, which I think is really powerful. So we're on number 10. We're almost halfway done already. I can't believe it. So everybody, our 10th pitch is Promera. And their goal is improve communication, to break down communication barriers through privacy-focused health tracking and sharing, empowering patients to gain more insight and control over their health, and giving healthcare providers an innovative tool to better engage with their patients and deliver more personalized care. Again, it's the common sense. Just love solutions like this. Let's watch their pitch.
Only 40% of people living in North America have at least one chronic disease, and for the most part, the care they receive in between clinic visits is rather lousy. If patient symptoms flare up, they can do one of three things. They can struggle through it until the next clinic visit, they can visit the emergency room, urgent care, or walk-in clinic, or they can deal with the frustration of trying to call the physician's office. All these lead to poor outcomes, discontinuity of care, and stress. This is a problem that my co-founder, Dr. Luke Rudmick, and I devoted our careers to solving. Luke as a otolaryngologist and me as a quantitative healthcare researcher. We've married our experience with a rockstar team of developers to come up with Interme. Interme is a two-sided platform developed to improve the efficiency of remote chronic care monitoring. We do this by using patient-reported outcomes. These are clinically validated surveys that measure patient symptom severity. The way it works is that patients receive a notification when it's time to complete their PROs. Physicians are notified if a score meets a threshold requiring their attention and sends feedback to the patient with next steps. The patient knows their symptoms are being actively managed and takes the appropriate action. Interme auto-bills the government for these messages and takes a 25% cut of the transaction, or $5 per message, leading to an estimated annual revenue of just under $3,000 per physician per year. We launched an alpha version in November with Luke's chronic sinusitis patients. We've been ironing out the bugs since, but we've proven that patients are regularly using and engaging with the platform, and we've also proven the revenue model. More importantly, we've already seen a dramatic impact on patients' care. Luke has been able to make no fewer than 12 early interventions because of Interme. Our roadmap has us expanding across Alberta, increasing the number of chronic diseases, building out a number of requested features, and developing new revenue streams. We are currently raising $500,000 to achieve this roadmap in the next 12 to 18 months. Thank you.
Just such a fantastic pitch. And for everybody, we're about to talk about this transition that the investors are going to make, taking these 20 companies, distilling them to 10, and showing early progress and impact is critical, and they're doing that.
Mm-hmm. Yeah, with those 12 early stage interventions, I can only imagine the impact they're going to have as they scale and grow. Really exciting.
Absolutely. So, hey, everybody, we're going to do about a 10-minute intermission here. And in this intermission, I am going to jump back into my slides. And just give me a second to pop it up here, everybody. So, yeah, you've seen 10 of the 20 companies so far. We just wrapped with Promera. And, you know, a couple of things that I want to share. First, for some of you who have not been a part of this process, and Lucy, you and I can chat about this a bit. You know, the Impact Investor Challenge is really designed to do a couple of things. One of them is to really help citizens from across Canada, whether you are accredited or non-accredited, you know, to be able to step into early stage impact investing and make a difference with your investments while also receiving financial return. And in addition, we are actively catalyzing capital, putting it into companies and seeing the impact results. So to give everybody a bit of context, we've already trained 130 entrepreneurs in the last 2.5 years. We've featured 150 companies with 33 finalists, over 600,000 in direct investment, but more than 15 million catalyzed as a result. And 4 of the 5 finalists in every program have been able to secure their funding raise within 4 months of completion. So it's been a powerful journey so far. Lucy, I'm just kind of curious, like, you know, you've seen some of the finalists that have gone through these programs. Like, what do you think the impact is for companies that are able to secure the funding they're seeking in a timely fashion?
Oh, that's a big question. I mean, it really depends on the company, because we've seen some great pitches tonight, and there's more to come, and the impact's going to be different for all of them. But regardless, it's it's going to be really exciting to see them be able to really grow their business and achieve some of those goals, some of those targets. But overall, huge impact. And I'm looking forward to seeing these numbers that we have here on the screen continue to grow for spring overall with our Impact Investor Challenge challenges, but also with the finalists from tonight. It's going to be a huge opportunity for impact and growth overall. Absolutely.
Agreed. Couldn't agree more. So everybody, while we're in this intermission, what we're going to do is we're actually going to give you a bit of an inside scoop as to some of the criteria that the investors are going to use in order to make these decisions. The program itself is a program that runs over a period of 11 weeks. We started off with more than 100 applications of incredible healthcare innovation companies from across Canada. You're meeting the top 20 tonight. We will end up at 5 finalists. And then over the remaining weeks, which is about 7 weeks from the 5 finalists to the finale, the investors will be digging in on due diligence. In other words, the homework that they'll do to help make an investment decision. Throughout that process, they'll have access to guest speakers and subject matter experts and mentors. So really like a lot of support and community wrapped around it. And that's all going to culminate in June when we do get to the finale and they select one or more winning companies. So really excited for this time. And just as a note for everybody, the link to the finale will be shared before we're done tonight as well. So an opportunity for you to just make sure you lock it in your calendar and support these incredible entrepreneurs as they're going through this journey. So what are the investors looking for? So just to walk through this a little bit, problem and solution. So they're looking for a clear definition of the problem. They want to make sure that they understand the problem and who is it for, like a clear understanding of the target market. And they also want to understand that solution. And I think as a part of that, they do want to understand how far along that solution is. Market opportunity. This is an important one. Some investors are looking for things that will change the world. Some are looking for things that will change Canada, and some will look for things in between. So the important part for the entrepreneur is not to pretend that their market is smaller or larger. It's just to say what it is and allow the investors to kind of, make their choices from there. Revenue and business model. I think this is an obvious one. We can't change the world if we go bankrupt, right? And so we need to make money in the right ways and have the right impact in the marketplace in order to actually scale and achieve the impact that we're trying to create. Now, this is an impact investor challenge. And so impact thesis and impact measurement is really important in this. And Lucy, this is an area that is of deep passion to you. What do you look for when you're talking to a company that is impactful, and how do you want them to kind of think about describing that?
I'm so sorry, my internet just decided to cut out. So I caught the tail end of that question. Had a little moment of panic. Sorry.
Yeah, I was just asking the question for impact. What investors, and in your case, like, what do you look for when you're meeting a company, say in our Tech Boost program in Europe, or in our Scaling Food and Beverage Entrepreneur program in Canada? What do you look for when they're describing impact, and how do you help them talk about it?
Ooh, that's such a good question. I'm looking for them being able to clearly articulate how are they an impact-driven business, or as some will call themselves, a sustainable business. How, and do they have the numbers to also back that up? Because it's so great to be able to talk about how you're an impact-driven business, but unless you can really show how you're doing that, those data sets, those numbers, it only goes so far. So that's what I'm really looking for. And also just love supporting entrepreneurs is diving deeper into their impact, how they're following the data, and also utilizing that data to in turn have a bigger impact.
Yeah, agreed. And by the way, everybody, as we're going through this, do click on the polls and vote for your people's choice from the first 10. And then we'll repeat that process again for the second 10 as well. Diving in on team, I think you all have seen, I think, some of the interesting dimensions of team. We've seen people with subject matter expertise. We've seen people with business model expertise. And we have also seen people who have shown the hustle and the adaptability and the resilience, right? These are all characteristics that we're looking for. And it is important to note that it has to be more than one person. When we're making investments, we need to see that kind of full team and believe that those key areas of the company are covered by, either co-founders or early team members. Traction, I think, is now, from today onwards, is going to emerge as probably the number one priority over the remainder of the program, right? So this first session today and next week, when they go from 10 to 5, the really important part is to understand the company and the market opportunity. But from then on, it's a great opportunity for the entrepreneurs to show hustle, to show progress, to show adaptability, to really show their DNA, right? And I think for me, that's such an important part here. And then competitive framing, I think some of you heard this in these pitches, and I'm curious if you guys want to comment in the chat as well. Some companies have patent applications, patents pending. Some companies are just out hustling the competition. So competitive framing sometimes is what I will call a moat wrapped around the company, like intellectual property. Sometimes it's just about getting ahead of the competition and staying there. And that's going to be a tough choice for investors and what they're looking for. So for everybody, these are the 7 categories that the investors right now are using to determine who they're going to pick their top 10. And these are things that you should also be looking out for as you're thinking about the People's Choice Award, and then thinking about who will go on ultimately to the top 5 and hopefully will win. Any final observations about the first pitches you've seen, like any general kind of trends that you saw across the pitches in terms of pitch quality or the decks or the kind of the tone, Lucy, that you want to share before we start to look at diving into the second batch of 10?
Thank you. I feel like overall, I personally I loved the personal stories that so many of the pitches had. It's such a compelling way to kick off a pitch, that strong, that why. And also, so they were all very visually compelling pitches. Keith, it's also funny when you mentioned for competitive framing, it's like a moat in some ways. There's a picture of an actual moat in one of the pitches. So yeah, really looking forward to diving into the next 10 shortly.
Amazing. So I just want to highlight to everybody, if you were to head over to the polls right now, what you would see is that Voxcell Bioinnovation is the current leading vote getter from you, the people. Now, I am going to say there's a lot more people here tonight than there are votes right now. So please get in there and put your vote in for who you loved. Would love to see it. And from my perspective, it's also fantastic to see every company getting votes. I think you're seeing the quality of those companies really standing out. But right now we've got Voxcell, we've got Flutter Care, we've got Rhea Health, kind of all top 3 leading the charge right now. But there's still lots of time to vote and lots of time to move forward. So I think we're heading in pretty good shape. Lucy, what do you think? Do you think we should start to look at the next batch of 10 companies?
Yeah, sounds great. Let's do it.
Okay, so Lucy, what I'm going to do is I'm going to allow you to introduce the first of our next batch of 10, which I think is AI Valley. Am I saying that correctly?
I believe you are. Yep.
Amazing.
Perfect. So AI Valley uses machine learning and deep learning techniques in real time to analyze the physician's voices during the procedures and data collected from medical images in order to have a critical impact on the quality of analysis and early detection of diseases, such as cancer, to provide the best personalized treatment model for each patient.
Endoscopy is an invasive and expensive procedure looking inside the body. It has to be done by trained clinicians or surgeons. During the scoping, clinicians have to visually analyze the images, monitor the patient, and after the procedure is done, they manually report the outcome. Unfortunately, because of the error rate, patient misdiagnosed, exposed to ineffective treatment, side effect of treatment, and low quality of life. I'm Azar Azad, CEO and founder of AI Valley. My expert and professional team of clinicians and I know this environment and the challenges very well. With the help of our technical team, we built an AI platform, Adria. It provides high-precision image analysis, helping to improve the error rate, and uses the speech recognition to generate instant patient report right at the end of the procedure. Adria is agnostic to the endoscopy device or the software on it and is very affordable. Therefore, we believe it can have a significant impact at the global healthcare system. The market is massive, and compared to other companies in this environment, Adria is the one that provides real-time image analysis, instant patient reporting with annotated images, and is agnostic to the other endoscopy devices. Basically, we believe they are our collaborators, not the competitors. Our business model is based on B2B, and we charge endoscopy clinics for annual license fee per devices. Our strategic plan to go to market is based on partnership and working with distributors, which I already established. I also have PO and multiple letter of intent from private clinics. I just closed the oversubscribed seed fundraising at $850K, raising 3 million Series A to finalize FDA and expand our commercialization. Thank you for your attention.
Wow. Keith, like you said before, why didn't this seems like something we should have, but it's incredible to see technology like this and such an impressive medical and technical team behind this company. And it's also great to see that they're thinking about growth on a global level as well.
And as investors, they're talking about some of the trials and some of the early agreements. They're starting to show the shape of the sales funnel. So they're starting to show not only progress, but how that progress will unfold. Loved their competitive framing. So that, I think, for me was absolutely fantastic. So up next, HealthQB Technologies. So HealthQB Technologies is a design forward and data strategy venture with a mission to revolutionize chronic pain care through providing affordable, automatic nervous system regulation technology. They do this by combining technology, data science, pain science, and a deep understanding of chronic pain. Let's watch their pitch.
Elliot, and I'm a co-founder of HealthQB Technologies, and we're tackling the global health problem of chronic pain. Chronic pain is a medical disease that affects 1 in 4 adults in Canada and costs our economy $40 billion per year. Although chronic pain is now recognized as having biological, psychological, and social factors, treatments for chronic pain are still predominantly biomedical and physical focused. The psychosocial factors contributing to chronic pain are largely ignored because they're harder to see and measure. However, because these psychosocial factors affect the nervous system, and pain is experienced through the nervous system, we focus on quantifying these psychosocial factors as a novel approach to chronic pain recovery. Instead of asking patients how much pain they're in, we focus patients on improving their well-being. We do this by prioritizing psychosocial factors they need to address, delivering daily app-based psychosocial practices that build resilience and reduce flare-ups, and measuring their nervous system's daily response to reinforce positive health behavior change. In our beta testing, we significantly improved well-being because our product helped our end users develop the psychosocial behaviors that enabled them to reduce pain flare-ups. Next month, we launch our MVP into integrated clinics, where many people in chronic pain seek alternative treatments after they've exhausted the medical options. In September, we will offer health coaching to accelerate behavioral change. And in November, we aim to release our direct-to-consumer app that can be paired with multiple advanced wearable sensors, setting us up for global reach. Our team understands the dimensional aspects of chronic pain recovery. We've lived it, helped patients recover from it, and built a novel chronic pain quantification system. We're now raising $1.5 million to support our mission of making the invisible disease of chronic pain visible for the hundreds of millions of people suffering from it.
You know, a couple of things that I would say about that pitch, because it was incredible. The first one is showing the clinical results, like showing those early results, the impact that they've had. The second one is, again, for investors, the very clear use of proceeds and how they can give confidence in how the money is going to be spent to kind of realize the scale and impact.
Mm-hmm. Absolutely. Really looking forward to seeing the growth of that company. And I also just love how they're focusing on the well-being of their patients or their customers, as opposed to the pain that they're experiencing. Huge opportunity for impact and growth.
Agreed.
Mm-hmm. So next up, we have Usha International. Usha International is a companion app for women in emerging markets that serves as a family gynecologist in their pocket. The app provides support throughout pregnancy and motherhood in countries where miscarriage rates are high, and not having a personal connection to a doctor can determine whether you can access obstetric care when you need it the most. Let's see their pitch.
Hi, my name is Ash Anwar, and I'm very humbled to present USHA International to you all. At USHA, our mission is to measure the health and well-being of women and work with health and development organizations to uncover new health insights and opportunities for early intervention to prevent pregnancy loss and maternal mortality. Many organizations around the world have initiatives in maternal health in emerging markets, and they need a way to access real-world data and analyze population health trends to inform their decision-making and measure their impacts over time. Our solution is to effectively acquire, digitize, and democratize access to this data from expecting mothers in emerging markets. Our app is currently in the hands of hundreds of women in Bangladesh who are using the app to ask questions to doctors and get advice during the pregnancy. Through our app, we can capture a lot of key information about their health and well-being, and we capture this information over the course of their pregnancy, which is valuable for identifying trends over time. Our business model is to provide access to this data to our target market that will use this data to conduct their own business. We can provide single point in time data downloads for organizations conducting health research. We can utilize APIs to connect to existing platforms that organizations use for public health monitoring. And we can provide access to our data for organizations to do predictive analytics to effectively target and track outcomes of public health policies and interventions. This is our team. Our team is made up of knowledgeable experts in the fields of business, data technologies, computer science, and medicine. Our contact email is below, and we are more than happy to talk more about our company, our missions, and our goals. Thank you very much.
Right. You know, it's so great to see how widely used this app already is in Bangladesh, and also the clear impact that it has on these women, and also the opportunity for being a data provider for a number of organizations. Huge opportunity there as well.
Yeah, and I think as well as investors, it's a clear opportunity to say, where do I want to create scope in my impact? Right. This is a product that has an opportunity to create really impact on a global scale, and especially in countries where they really lack some of the access to technologies and services that others have at their fingertips. So I think that makes for a really challenging set of decisions for the investors. So fantastic. Up next is Mommy Monitor, and Mommy Monitor is a care access platform that connects healthcare institutions, providers, and pregnant persons to a diverse range of culturally safe maternal health services and supports. So another company here in the top 20 that's really focused on parents and unborn children, and really kind of the family dynamic. And so really excited to hear this pitch from Mommy Monitor.
Moko, and I'm the founder and CEO at Mommy Monitor. Throughout the world, pregnant persons continue to experience complications that lead to death. A large part of this problem is due to misinformation, a lack of access, a lack of social support, and a lack of culturally safe care, specifically for the Black community, all of which leads to adverse outcomes that can lead to death. The solution is Mommy Monitor, a virtual community health center for maternal health, where we customize your care. We provide access to a marketplace of professionals who are culturally safe. We help you to filter out your preferences so that you can be connected to the right professional. And then we support you by finding the right services and follow up with your care over a long period of time. Currently, we're offering care directly to pregnant persons through our website, with a service-based revenue model, but in the future, once our app launches, it will be a prepaid subscription model that works directly with clinics and other healthcare institutions. We're focusing on aggressive social media market for our go-to-market plan, and we want to continue to build partnerships and build our email subscriptions with the 1,000+ professionals that are already a part of that. Right now, we're focused on rebranding, and we hope to launch the app in June and begin our seed rounds. What makes us unique and special is the fact that we don't not only provide culturally safe care at a level that can be scalable and increase the accessibility to different services, but we also customize care, which is something in this space that's not being done. Over the last few months, we've received 2 contracts from the government worth over $500,000, and we're continuing to build our partnerships and serve all the clientele that we currently have. We've been a part of various accelerators, most recently Google for Startups, and won various awards. And our team is filled with experts with PhD level expertise in research and science in the space, and engineers with backgrounds in computer science. Currently, our ask is $2 million to continue to grow our team so that we can move forward and scale. Thank you.
You know, for me, like, such an incredible example of a team that has proven an ability to, you know, create progress and momentum, revenue, contracts, validation in the marketplace, including technology partners like Google. Like, for me, I think just really, really impressive.
Very impressive. It's great to see the traction that they're already starting to have, like you said, in those partnerships. Yeah, huge opportunity for impact there. And next up, we have Raft Digital Therapeutics. Raft Digital Therapeutics is a digital rehab startup making medically necessary pediatric rehabilitation exercises engaging and engrossing by delivering rehab in an immersive story-based video game. Let's see their pitch.
It's Jeff, and I'm here from Raft to tell you about how we're delivering ancillary therapies in high-value therapeutics markets. Up until recently, most genetic conditions were considered untreatable. However, with the advent of genomic therapy, we can now provide a medical treatment for many genetic conditions. However, there's a big gap between a medical treatment and a functional outcome, which is what patients are looking for. And that's where we step in. We provide the digital tools necessary for patients to achieve a true functional outcome. And this global digital therapeutics market is worth about $7.2 billion annually and growing. I want to drive this home with a discussion about a disease called spinal muscular atrophy, our launch market. In SMA, the genes that code your nerves don't work as well, and as a result, your muscles don't work that well either. There is a new genetic therapy that can help the nerves work better, but that doesn't make the muscles work. And that's where we step in. Our launch product is a fun video game that uses motion capture technology to encourage children to participate in the therapeutic exercise they need to achieve a functional outcome. By making rehab fun, we make sure that it gets done. We're starting with SMA. We've partnered with a major pharmaceutical that understands their medication, which is worth hundreds of thousands of dollars per year, could benefit from sales of a digital therapeutic worth hundreds of dollars per year so that patients can get the functional outcome they need. But we want to expand to other diseases like Duchenne's and JIA in the future. Thus far, we've achieved a $150,000 investment from pharma because they understand the need. We've also done some great community engagement involving individuals with SMA, advocacy groups, and medical experts in the field. But most importantly, we'll be launching our MVP in July of 2022. I'm a physiatrist, which is a rehab physician, so it's safe to say this is my life's work, and I'm a serial entrepreneur. Mark is a child with SMA, Lawrence treats patients with SMA, and Stephen has launched many successful video games. We're asking for $55,000 to add multiplayer functionality to our MVP, and $45,000 to hire 2 individuals with SMA onto our team. Thanks for your time.
Fantastic. Jeff has such great pitch delivery, and also, coupling video games with rehab and physical rehab that you'd have to do. Like, I can't think of something more fun, and also just what a great way to engage children in their own health and healing.
Yeah. Well, it really shows that they're going to meet them where they are and what they understand. And I think that's critical. And then the other thing that I think is a big highlight as an investor is lots of sectors, lots of disease categories that they can focus on. I love the fact that as a startup, they're focusing in one area first, SMA, prove the idea, prove the business model, then they can expand in the future. I think that's a really, really sharp way of doing it. And something that I was quite impressed as they went through. So up next, Imaginable Solutions. They create assistive devices to improve the quality of life for people living with disabilities. Imaginable's lead product is Guided Hands, an assistive device that enables people living with limited hand mobility to write, paint, draw, and use touchscreen devices. Really excited to see this pitch.
My name is Liana Genovese. I'm the CEO and founder of Imaginable Solutions and inventor of our product, Guided Hands. Meet Elijah, a 10-year-old boy living with cerebral palsy. In this video, I ask him to write his name, but he struggles to write the first letter because he experiences limited hand mobility. Elijah loses his ability to express himself. This leads to social exclusion, and this also slows his start to learning. Elijah is one of 58 million people of all ages living with a medical condition or injury that affects their hand mobility. Our solution is Guided Hands, an assistive device that enables people experiencing limited hand mobility to write, paint, draw, and access technology through touchscreen devices. Our unique sliding system promotes controlled and guided hand movements as a user holds a 3D printed handpiece tailored to their level of hand impairment. Guided Hands also improves quality of life through promoting independence, confidence, and creativity. We sell Guided Hands for $525 B2B and B2C to medical associations, healthcare facilities, including nursing homes and rehabilitation centers, assistive tech centers, as well as to school boards, specifically for children living with a disability. Guided Hands has been used by over 350 health professionals and patients across North America in both paid and unpaid pilot projects. We have a great team of researchers, advisors, and engineers, and together we have 92 pre-orders for Guided Hands across North America and Singapore. We have fulfilled 20 of them, and we expect to have a revenue of $38,000 within the next 3 months. Our ask today is an investment of $165,000. This will go towards manufacturing our next 450 units, marketing, and using the money for IP. As well, we would love to prepare a global scaling strategy with some mentors and with your help. Together, we have the ability to improve the quality of life for all, because at Imaginable Solutions, we enable people to live the life they imagine.
Lucy, they say a picture is worth 1,000 words, and I think that video might be worth $100,000. It was, I don't know about you, like you hear the initial tagline and then you see the video and it really describes it beautifully. But the other thing I would say is, as an investor, love the fact that they were really crisp and detailed on the amount that they were looking for. They're not just randomly saying $500,000 or 50 grand. Like, they know what they're looking for. They know why they want to spend it. They know how they're going to spend it. And so it's kind of a refreshing piece there.
Yeah, absolutely. And they've really thought out their sales strategy and their funnel with great traction in the market as well. So certainly an excellent pitch. So up next, we have Definity Solutions. Definity Solutions is a medical device company designing and developing Need Switch, the world's first interchangeable and modular auto-injector solution for emergency medication delivery. As a physician-developed solution, Need Switch will improve patient outcomes in emergency situations such as overdose, cardiac arrest, and anaphylaxis. Let's see their pitch.
Hello, I'm David Kim, an emergency physician by background and a co-founder of Definity. Meet Sarah, a university student who had an accidental overdose at a party. 911 informs you she needs naloxone, a life-saving medication you must give within 60 seconds or Sarah could die. Although most public facilities and many concerned citizens now carry naloxone kits, people like Sarah still suffer due to the complexity of the kits. Because when you open the kit, you find a confusing set of equipment and instructions with more than 8 steps involved. You panic and you can't give the medication because it's too complicated and takes too long. This was why we couldn't save Sarah. She's now among the more than 983,000 people who've lost their lives to the opioid crisis. In fact, some provinces and states, this crisis has claimed more lives than COVID-19, homicides, and car crashes combined. Now, meet Need Switch. Need Switch uses a pod-based plug-and-play medication delivery system, much like a Keurig machine, except instead of your cappuccino, the pods will contain life-saving medications like naloxone. So during time-sensitive emergencies like overdose, Need Switch breaks down a confusing 8-step process that can take up to 5 minutes into a simple 2-step process that can take less than 30 seconds. And because of this innovative pod-based design, it has applications for various other drug targets like epinephrine for anaphylaxis, military medicine, and pre-hospital uses. We're a team of medical doctors, engineers, business, and regulatory experts who've taken multiple medical devices all the way through to regulatory approval. Over the last 2 years, we've created a fully functional alpha prototype and submitted 3 patents in multiple jurisdictions. Our next steps are to initiate preclinical testing in preparation for regulatory submissions in partnership with the top 5 global contract, pharma, and device manufacturer that we have an agreement in place already. I hope you'll join us in impacting how emergency medications are delivered to save lives, starting with the opioid crisis.
Wow. The opioid crisis is something that we absolutely, of course, cannot ignore. And David demonstrated how well this product will work better than the existing solution. I love the comparison between their solution and also Coffee Pods. It really makes it clear to the audience and investors how their product works.
Yeah, absolutely. He said from 5 minutes to 30 seconds in terms of the ability to administer the medicine, and that is truly life-saving time. And so I think it's really powerful. They're actually a prior finalist in an Impact Investor Challenge. I can absolutely see why they've been selected into the top 20 again. And I think it's really powerful. So thank you for that, David. And up next is Gingerdesk. Remember I said earlier, people sometimes common sense. So this one is right there. Gingerdesk is a virtual admin service that helps health practitioners to grow, build, and scale their practices one task at a time. Let's watch the pitch.
Gingerdesk, virtual assistants for health practitioners. My name is Dr. Julie Dernan. I'm a naturopathic physician with 16 years experience in practice and running efficient integrative clinics. In 2020, 80% of clinicians moved their practices to telehealth. We saw an increase of 175 times more virtual visits across some health professions. But these clinicians weren't set up for a virtual workflow. In fact, 81% of clinicians saw a drop in their revenue, with an average of a 31% drop seen in some disciplines. Clinicians were busy, but they couldn't afford the time or the money to hire and train someone to step in and lend a hand. Gingerdesk is the solution. We are disrupting healthcare by hiring, training, and managing industry-trained virtual assistants and matching these VAs to health practitioners across Canada and the US. This is the Ginger way. Our promise is the health practitioner's perfect admin match. Practitioners pay by the minute for one of our North American-based VAs. We have a recurring revenue model of memberships and offer 3 tiers of packages that are customized to the practice's needs. Our impact is job creation. We empower employees to thrive by providing a family wage, remote work, and we allow for flexible schedules that support wellness. We currently employ 30 VAs, and this will grow to over 2,000 by 2024. Gingerdesk has been profitable since month 1. To date, we have generated $680,000 in revenue in just over a year. We are on track to $2.6 million for this year. There is a massive market opportunity for us. Telehealth's global market size is $636 billion. There are 6 million potential clients of ours across North America alone. Gingerdesk is raising $1 million at a $5 million valuation in order to expand across the US market, grow our business development team, and support and train our VAs. Telehealth is a huge growing global industry, but there is a gap. Health professionals need admin support and they don't know where to turn. We offer admin freedom to health professionals. The future is bright for us. Join us.
Yeah, fantastic. And, combining that common sense with proven traction, right? If investors are thinking, I want that proof point of revenue to then know that I have a greater chance of success here as an investor, 680K, on track for 2 million plus, like that really gives investors some confidence and potential trust there, Lucy.
Absolutely. And very impressive. Very impressive. And also just a beautiful pitch. And they really leverage the use of data and statistics well in this presentation. Yeah, great pitch.
Amazing.
And next up, we've got UVX. UVX has built a smart sealing device that disinfects air and surfaces using a form of light that is safe for human exposure, but lethal for pathogens. Let's see their pitch.
Hello, folks. We are UVX, and we make indoor spaces safe from pathogens. In June 2020, we came across an article that read, 81% of all COVID-19 deaths in Canada have been in long-term care. News article after news article, it became clear to us there was something deeper than just seniors are more vulnerable to COVID-19. We learned that senior homes have always had infection outbreaks, even pre-COVID-19, with about 400,000 deaths every year in the US alone. If you're wondering why, it's because chemical disinfection alone just doesn't work, leaving over half of surfaces uncleaned with no impact on the air. I'm Kunal, CEO of UVX. We're a diverse team of engineers and scientists at UBC's Division of Infectious Diseases. My co-founder Samir and I are both engineers, full-time on UVX, and have previous experience building a startup. We have developed the world's first smart sealing device that uses a unique form of light that is safe for humans but kills pathogens in mere minutes. This means you can kill pathogens continuously on both surfaces and in the air, even when humans are present before the next cleaning shift. We have run human trials to validate safety and shown high efficacy against pathogens that cause infections like COVID-19, influenza, salmonella, and many more. That's why WHO itself has recognized this technology as a feature of disinfection. In just 1 year, we've built a prototype, secured global rights to the IP, and built a $1.8 million sales pipeline. We've also partnered with Louis Braille Home and Hospital for trials, and will soon support Nova Scotia Health to run pilots in long-term care. We offer a leasing model with the option for a one-time buyout with a market opportunity of $90 billion. We are raising $1 million to complete pilots, get certified, and fulfill pre-orders. We've already secured $200,000 from angels, including a C-suite member at AstraZeneca. Thank you.
Fantastic. Canal has a really great, well-encompassing pitch and story. And I feel like, especially coming out of the pandemic, this is something we all need. Like I've been saying this whole evening, want to make use of all these technologies. And I also feel like, I've seen the use of UV in food products, and especially in juices. There's some new technologies happening in Canada utilizing that. And it didn't even occur to me that we could also use it in our spaces. So really great to see this pitch.
Yeah. And well-rounded progress, right? Prototype built, patents pending, early partnerships, established pipeline, early investor traction, 20% of the round committed, like just really nice holistic progress that can really drive confidence, which I think is really exciting. So everybody, last pitch coming up. Precare, this is it. Precare is a digital patient education platform that provides evidence-based medical guides and as resources for patient engagement. Let's watch our final pitch and then we can get to the polls.
Hello, my name is Raphael and I'm the proud founder of Precare, where we support healthcare teams with personalized patient engagement. During my studies in experimental surgery and time in clinic, I learned that patients forget most of the information provided to them, which affects their healthcare poorly and affects the healthcare system poorly. The problem today with patient education is that it's fragmented. There's outdated formats, there's a language and cultural barriers between patients, there's no data, no tracking, no feedback loops, and a lot of patients end up turning to Dr. Google, which has its own risks. Our solution provides customizable patient education, provides a communication channel to track everything with AI integration. Everything that we do revolves around digital solutions, and we do everything with accessibility, flexibility, and sustainability in mind.
We offer the latest medical information written by experts, brought to you through easy-to-understand, interactive instructional videos. At any time, in over 20 languages.
So the healthcare provider will choose from a library of hundreds of guides that they can customize. They'll provide the access to the portal to the patient. The patient will get all the information that they need specifically for them. The patient will engage with it, and then we'll be able to have improved care pathways through a recommendation system. We've worked with the Government of Canada, with academic hospitals, with medical societies, and are experiencing an international expansion with a lot of demand. And this has led to $665,000 of revenue predicted for this year. Our market size is very defined. Our addressable market is something that we're very much looking to address. Our competitive landscapes exist of patient education companies and patient engagement companies. We're the main company that is providing both of those with analytics and data and engagement. This is our forecast. These are some of the matrices that we're very proud of, and we're growing exponentially with them. Our team is composed of passionate healthcare providers, communications, patient educators, graphic designers, so we work very nicely together. Our ask is for the portal commercialization, international market expansion, and higher sales positions. Thank you.
All right, so that's our 20th pitch. Very, very exciting to get to this point. By the way, huge market potential for that opportunity.
Yeah, absolutely. And partnerships with hospitals so far, that's fantastic to see. Yeah. And also really fun video during the pitch as well to demo the product. Great pitch overall.
Amazing, amazing. So what we're going to do is we're going to move towards the next step in the process, everybody. So a couple things. First, we are going to be setting up the polls for you to do your next batch of top 10. Poll is not yet live, so as soon as that's live, we'll let you know. But there's a couple of logistics slides that Lucy and I are going to walk you through in the meantime. And then once we have that poll up, we're good to go. And guess what? The poll is up. So everybody get over to the polls. So again, if you look at the chat thread, just at the top, you'll see it says polls. Click on polls, start voting for your favorite company from the second batch of top 10. And then while you're doing that, I'm going to dive into my share screen. And we're just going to cover off a few logistics things, everybody. So first things first, I'm going to dive into slideshow, and it is loading, and there it is. Excellent. Okay, so hey everybody, impact investing in 2022. So a couple things that are coming up. You will see the finale of this program in June, where one or more of these companies will be selected for investment. Some tough choices coming out. You're about to hear the top 10. And then what you will hear is the top 5 and the finale coming up again in June. But in the fall, we have a number of opportunities for you to engage as audience members, as participants, as entrepreneurs, as well as participants as investors. So in the fall, we will be doing a Calgary Impact Investor Challenge, looking at opportunities in Alberta for impact investing. There's some incredible announcements coming out of Alberta, Lucy. A circular economy fund from the Alberta government. And then today there was an impact investing fund that was announced with the support of TELUS Pollinator Fund. So some amazing things happening there. We will also have a Gender Lens National Impact Investing Challenge first. So really designed to bring to light, the incredible talent that exists with gender diverse founders and co-founders. I think it's also a fabulous opportunity for gender diverse investors to come to the table, regardless of your current kind of journey on investing. I think it's an incredible opportunity for education and empowerment. And then as well in the fall, we will be doing a Southern Ontario Impact Investor Challenge, so Ontario specific. And Lucy, that means I'm going to be in person in Ontario in the fall. So I'm looking forward to it. I know, right? So we're looking forward to that. And then everybody, sneak peek. Spring is launching a national impact investor network called the Spring Investment Collective. So we are excited to be sharing more information for you on that. We can't wait to dig in and kind of have your feedback on that and get you to be a part of that particular program. So really looking forward to that. Now, what's next? Please do take a couple of minutes to answer our survey. And so I'm just going to make sure that we're going to see that in chat. So the polls are open. Survey is coming up. And Melanie, yes, absolutely. Come over from Quebec. It'd be amazing to see you in 3D again, for sure. And so everybody, the survey is in the chat. And just very quickly, these events are for you, right? And for the companies and for the investors, please give us feedback. Tell us what we're doing right. Tell us what we can improve on. We want to make sure that we're catalyzing impact investing, and we are supporting entrepreneurs to grow, scale, change the world, right? So the more feedback that you give us, the better. Would be absolutely amazing. The other thing is link coming up in chat, and you will see that link for the top 5 finale. That is June 8th. Mark your calendars. It's going to be an incredible event. We're really excited to see what's happening there. And then a final thing, we are incredibly excited to welcome Genus Capital Management, which is one of the country's absolute leaders in impact investing, financial service, and advisory. They are an incredible organization. They were a community partner of ours last year and did a phenomenal job. They're really also carving the path forward in gender diverse investing, in supporting both female founders and funders. And so we are thrilled to welcome them into our community of sponsor partners as well in 2022. Lucy, just such an incredible group that not only supports us, but is supporting all of the investors through all the programs, all of the companies as well. And so just a thank you goes to all of them.
Absolutely. Huge thank you, and really excited to have them on board as sponsors. Really looking forward to growing that impact together.
Absolutely. So just a big shout out to Shannon and the entire team there, Mike Thiessen, and just really thank all of you for being a part of our community. So I need to do something very funny here. So if everybody remembers from a couple of years ago at the Academy Awards, there was a slight mix-up in the voting cards. And so one of the quirks of Hopin is that if I am in presentation mode and my team makes a last-minute change to the top 10, I won't see it. So I'm going to very not so subtly, I'm going to come out of my screen present, and then I'm going to pop back in, which is going to automatically update my slides. And in doing so, I hope you guys saw the second piece of magic, which is Kristen is back. Welcome back, Kristen.
I am back. Thank you, Keith and Lucy, for running the show. So the investors had a really tough decision to make. And I'm sure the audience here really enjoyed the pitches as well. So I come kind of speaking on behalf of the investor group after what was a lot of information to kind of digest in that short little bit of time. But overall, the consensus was really excited about all the 20 companies. And we do kind of wish the best for all of these companies and hope that you continue to engage and reach out for us of support. And please, for anybody in the audience, for the companies that don't make it to the top 10 tonight, they're all, incredible companies and great opportunities. And I'm sure that they all have, us for support and help. So encourage you all to be in touch with all of the 20 companies tonight and help to share that love. But with that being said, Keith, we did come to a decision, and we do know who our top 10 companies are that are advancing on.
Amazing. Does anybody want to do physical drum roll, or are you ready? Just want me to hit next page?
We can just go.
Here we are.
Here are our top 10 companies. Congratulations to all the entrepreneurs. So in no particular order here, we have AI Valley Inc., Mindful Garden, Voxcell Bioinnovation, TalkTech, Mommy Monitor, Imaginable Solutions, Definity Solutions, Gingerdesk, UVX, and Lyme Health. And so these are the 10 companies that will be advancing onto our program and are invited to come and pitch with us again next week.
Yeah, incredible. And, one of the things I love about this particular group is we can really see the diversity of the solutions that the investors are looking at, right? We're looking at, pregnancy care. We're looking at overdose prevention. We're looking at, operational efficiency for doctors, like just incredible diversity, Kristen.
Absolutely. And even just kind of quickly taking a glance at this, I do think, like you said, we are seeing diversity in terms of representation of the founders that pitched tonight from this top 10, as well as just the different types of healthcare companies. I'm still seeing quite a lot of digital health, but also medical device, diagnostics, and we've got some of the more unique ones in here, like Gingerdesk as well.
Yeah, absolutely. Yeah, I think it's a great representation. I know we also have some really, really good geographical diversity in this group as well, and I think it's going to make for an interesting and challenging process for the investors next week. So for everybody who's watching, as we're coming to a close and heading towards our networking, Kristen, what happens next week when the investors are going from top 10 to top 5?
Yeah, so the companies come out again and they'll be doing live pitches for the investors, a little bit of a longer form pitch, and there'll be a Q&A period. At that point, the investors have the chance to learn a lot more about these 10 companies, and they'll be selecting the 5 companies that continue on in the program. And Keith, those 5 companies are actually the main companies that will go through a training period with us for a couple of months' time. And we'll actually do formal due diligence into those 5 companies who will be kind of up here. At that point, Keith, I know you've mentioned our finale event that's in June as well. And so those 5 companies that are selected next week from this selection of top 10 companies will be the ones doing our longer pitch at the finale event on June 8th.
Yeah, absolutely. And just as a highlight, Kristen, I know you were knee deep in negotiation with the investors to pick the top 10, but did want to highlight the people's choice, Voxcell and Gingerdesk. So great to see how you, the audience, were able to see that same, kind of kernel or nucleus of opportunity with those 2 particular organizations. And so really, really exciting to see that here in the mix. Should we dive into what's next?
Absolutely. And I'm loving all the comments here coming in the chat as well.
So I think we have, to connect with Spring, of course. We would love to see everybody here. connecting with us. And a couple of the links are in chat again for the finale and so forth. Do also connect with the Pollinator Fund team, especially the entrepreneurs that are in the room. Then I think next we're moving into networking, are we not?
Absolutely. So we're here at the end of the event. If you would like to get to know the investors that have been voting, the companies that you've been seeing upstage pitch, and also all of you in the audience that come from all different walks of life, encourage you to join the networking rooms. On the left side of Hopin, you'll see a networking and sessions option, and feel free to jump into those sessions and get to know each other.
Amazing. Yeah, and everybody, I really encourage you to dive in, say hi to the companies, say congratulations, get to know everybody. It takes a village to raise a business. It takes a village to change the world. And so would love to have you show your support and your enthusiasm. Feel free to ask questions, as Kristen mentioned as well. Kristen, what an amazing start for this particular cohort. I can't wait to see who gets picked for the top 5.
I can't wait as well. And thank you, Keith, for joining us at this event, and Lucy as well. And of course, the whole TELUS Pollinator Fund team and the audience. So thank you all so much for joining us today. And let's continue supporting these startups the best we can.
Awesome. So everybody, we're coming off of the main stage. Click on sessions, which should be on your left, and then pick your session of choice. We will see you over there. Thanks, everybody.